she was initially diagnosed with schizophrenia, and the medications that she was given, and because she wasn't being heard or listened to by her doctors, the medications really progressed her disease faster than it should have. I love you. Oh, super nervous, super nervous. Hey y'all, welcome back to another episode of Caring for Carlos, A Daughter's Journey. So I had the honor to attend the Coalition for Compassionate Care of California's 17th Annual Palliative Care Summit. A few years ago, I was invited by Stanford's Palliative Care team to be part of a storytelling project that they had done with a few people. I think there was about 4 of us. Doing that project lit a fire in me, and it made me realize that this was my calling. When my mom was still able to talk and she sort of knew everything that was going on in her mind, she made it a point to tell me to make sure that I educate people, make sure that I share her journey, our story, and help other people who are going through the same thing. So this video is about that. It's dedicated to my mama. I'm going to show her this video as soon as it's posted, and I hope you guys enjoy.
One of the things that I really find captivating from Sherilyn and is that she's gone on to do this type of work, not just with RT, but she has done a podcast episode on the heart of hospice.
Carlos, hi. Guess what? Look at me. Guess what? So, you know your doctors, how they've been helping us a lot, and I've been able to do these videos and stuff, you know? I get to go and speak about what's going on with you and teach people about how important it is to make sure that you have patients that come in and they're telling you that something is off or something's a little bit strange, that they make sure that they actually listen to us, you know? And all that stuff that we went through, from you getting lost in the streets and they thought you were just sad and had all those mental health problems, which, you know, some of that might have been right, but we know, like, in the reality of it all, that it was what this is, you know? You know what I mean? Yeah. You have the most beautiful curly hair. You have the most beautiful curly hair. You hear me? And I hope that with all this stuff that we're doing, I hope that it really makes a difference. So, all that work that I've been doing, Mom, and trying to help people understand what dementia is and how unfortunate it is that we have to live like this, and how unfortunate it is that you have to go through this at such a young age. But I'm grateful that you're here with me. I'm thankful that I can still come here and spend this time with you. And guess what? Look, Carlos, guess what? I love you. You hear me? Do you hear me? I love you. I noticed that you've been a lot more tired. Are you okay? So one thing that I have noticed is you're a little more sleepy, a little bit more tired these days. What's that about? Hmm? You want to see something funny? Can I see this for a second? Let's show the people. So this is a fidget board. Let me see. Can you hold it for a second? Look at what they did to the fidget board. They put the middle finger up. That is too funny. This side, it just has stuff that you can, I guess, like touch and mess with.
I'm sorry.
There's people in here, so I'm trying to block the sound out because it's so loud. Some design essentials for her. Let's get you styled up, girl. Y'all don't judge me on my braiding. I'm not a professional, but I do the best that I can. I'm an underhand braider. So, I don't know. I don't really have no rhyme or reason how I braid. I just go. I was trying to make a movie. I got all this background noise. I know people gotta visit their people, but yeah, damn. Girl, look at you, girl. You look good. Your lips are chapped. Can I put some of this on your lips? Like this? Yeah? Here, let me see. Come here. There you go. There you go, girl. You can't eat it. No, you can't eat it.
You'll have to be in the hospital soon.
You're doing a good job. Yeah, you're doing a good job. You're doing a good job. Yeah, yes you are. Yes you are. You're doing a great job. I know I'm always coming here and messing with you, but I have to do what I gotta do. Relax, relax, and give you a nice little massage. Doesn't it feel good? Ooh, look at that. Look at that. Yeah, look at them guns, mama. Let me see, make a muscle. Let me see how strong you are. Can you flex your muscle? This is Carlos. I'm Sherilyn. This is my mom.
Oh,
She's been here a couple of years, maybe 2 now.
yeah.
So, same thing. I pop in when I can.
You take care and have a good evening.
You too.
I'm sure I'll see you again.
Yes, you will. Does that feel good? Let me put some Tiger Balm on your knees. Let me put a little bit of this on your knees too, okay? I'm not sure what happened to the sound right here, but she's all oiled up, hair's done, her nails are clipped, massaged her hand, put some CBD balm on it, just making sure her skin is smooth and taken care of. And like I said, I'm not the best braider, but it works. It's been growing her hair out. So look at her. Look at that hang time. Check out her hang time. Look at that. Look at that. All right, Carlos. Okay. Yeah. So this right here is what I've learned is seizures. They're called absence seizures, meaning she's not convulsive. It's nothing like that, but she just kind of goes into this blank stare and I don't like it. I don't like it one bit. Okay. I'll see you later, okay, Carlos? Okay? I'll see you tomorrow. And then I'm going to leave on Sunday. Got it? You don't got it? I love you. Do you know that I love you? Carlos, do you know that I love you? You do? I love you. Yeah, you know that I love you. Okay, can I have a hug? Are you gonna hug me this time? Yeah, can I have a hug? Yeah. I love you. Okay, you ready to go eat now? Okay. All right. So I'm almost ready to go. Come on, phone. Come on. Snap. Almost ready to go. It's tomorrow. Just sat up in the bathroom all day and did this raggedy hair of mine. I mean, it ain't raggedy, and you know. But yeah, I'm excited. I'm gonna go get these feet hit, honey. One time for the one time. Get these eyebrows done. You know, eyebrows. Oop, bugging it. You know, eyebrows make all the difference. So I don't care how long I gotta sit up in that bitch. I'm finna get my feet and eyebrows did, cause wish me luck. Old school 90s style lip liner and a little bit of lip gloss. A little ombre effect. Turn his music up and get going. I'm thinking about stopping somewhere and getting me like a blogging camera, because I really need one. I need one for this weekend. I need one in general. I need one for the Alzheimer's walk. I need these eyebrows done. Yep. That's what I'm talking about. There we go. There we go. Honey, yes. Yes.
I've been feeling like a bad bitch all goddamn day. If you ain't my bitch, you just a bitch in the goddamn way. You say you die for your.
This doesn't work. It needs a lot of shrink.
So what are you gonna do?
Okay, let's try on the other dress.
It's a video.
The dress underneath is not good.
I love you. I love you. Look at you.
That's what I'm saying.
Look at you. You such a handsome man.
You gotta try something.
You too. You such a handsome
I think
man.
the shoulders could still be more.
Yeah, this is the only one of them, but I can
I love you.
hand sewing is a major component to execute
I love
that
you.
design, and I don't have a lot of time left.
All right. So I made it through security at SFO. Super excited. Super emotional. But I'm just, I don't know. We're flying out. Saying we. We're flying out of Alaska. Gate E8. I'm walking through here like I'm a somebody. Look at this. All right, folks. We're off.
It is on.
Hey y'all. So I'm a little nervous. I'm excited. I'm nerve-sighted. On my way to Costa Mesa? I don't know. We'll find out the proper pronunciation of that word. For the CCCC Caregiver Conference. pardon me, because I'm not used to talking to the camera. I feel awkward, I feel weird. I don't know if I should look here, I don't know if I should look there. But anyway, was up this morning with the jitters, nervous, and then, just like self-realization. Like, how they say how somebody, like I am who I think I am. I have to really learn to walk into my purpose and walk in my purpose and realize that I am who I think I am. So on this self-care journey, on this advocacy journey, I'm just sitting up here really proud of myself. Yeah, I don't know. Walking through the airport with these stunner shades on, doing my homework. I know y'all see them red marks. I've been fucking up. This advocacy stuff is really my calling. It's my calling. It's calling me. Have y'all ever had to go to the airport and not had to go to the airport, but have y'all ever been in the airport and realized that y'all was missing something? I was missing a charger because my gimbal was dead. I thought I charged this thing before I left, but when you plug shit up to your computer, it don't charge the way that you think it's charging. Honey, it was not charged. I'm sitting up there trying to record and make a video so that I can, have something to edit when I come back and post on YouTube. And boy, oh boy, was that shit dead? It was dead. But it's embarrassing how much money I had to spend on that little funky ass cord, and I had plenty of them at home. And I got an old iPhone, so it still uses that other plug and not the USB-C. So had to buy me a raggedy ass cord for hella dollars. I'm so ashamed. I'm so ashamed, honey. $7.83. $7.98. Okay, y'all, here we go. This is what I'm wearing. Wish this thing could zoom in, but it doesn't work. I'm hoping that I'm not giving too much body yaddy. I'm always self-conscious about my body, but this is about me. This is about my mama. This is what it's given. This is what it's given. I'm trying to give Black Girl Magic per usual. Oh, super nervous, super nervous, super nervous, super nervous. All right. Super duper nervous. So it's the morning of the conference. I'm nervous. I skipped breakfast. I know I should eat something, but I had to get my jitters out. So this is what it's given. Oh, my goodness, my goodness, my goodness. So I was up late last night, couldn't go to sleep. Just excited, emotional. No, just reflecting. Like, I'm so grateful. I'm super thankful for Stanford Palliative Care for giving me this opportunity, for always calling me when there's opportunities to spread the word about what I do, awareness, and just really supporting me and my mama over the years because, I mean, it's hard, It's hard when you know that all it took was for somebody to just hear you, listen and actually hear what you're saying and help you for real. So, getting ready to go downstairs and maybe go to Starbucks. Yeah, my stomach is in knots. All right, here we go.
Can you hear me? Good. Okay, just want to welcome you to this sessions called Utilizing Patient and Caregiver Voices to Promote Palliative Care. I am Dr. Towley, one of the members of the Board of Directors for the Coalition. Just want to welcome you to these sessions. And let me introduce our speaker today. Ann Cao Nagasalwa is a tobacco treatment specialist and the program coordinator for the Health Education, Engagement and Promotion Department at Stanford Healthcare. She conducts patient outreach and recruitment efforts and also provides marketing and administrative support for the Palliative Care Center of Excellence. Olivia Narimura has over 9 years of experience working for Stanford University, where she first started as a clinical research coordinator. Back in the early January, she became the new project manager for the Palliative Care Center of Excellence. And Dr. Glenn Smith is a palliative care physician and clinical associate professor of medicine at the Stanford School of Medicine. He is the medical director of the Stanford Palliative Care community. So just want to welcome the speakers and also welcome you to these sessions. Yeah?
Great, thank you so much. Thanks so much for coming to our session this morning. We're so excited to be here to talk about how we can use patient and caregiver voices to promote palliative care, especially out to the public or even to community groups that might be reaching potential patients and caregivers. In our session today, we'll talk about a project that we did at Stanford to create 4 patient and caregiver video stories. This is patients and caregivers telling their stories about working with palliative care. we'll show you those 4 videos, then we'll have a breakout session so you can think about like how could you use stories like this in your own practice or with your own organization. And then we're very fortunate that Sherilyn, one of our storytellers, is here today, and she'll be talking about her experience, sharing her story, what it's meant to her, and how she's really kind of integrated this into some of the advocacy work that she's continuing to do.
Sherilyn describes how she and her mother found comfort and support through their palliative care team, and her story reflects the challenges that many caregivers go through when providing care for their loved ones, especially those living with dementia. So we'll go ahead and start with Sherilyn's video. And then also this information that I just read off, it's in the handouts that Grant passed out earlier, and you can find that information, and also we included some of the links, and then we'll also have links later on where people can identify the videos. So we'll go ahead and start with Sherilyn's video.
The best thing about the team is that they are clinicians, but they don't feel like clinicians. They feel like people who are advocating for us, who really want to help us and have the time to help us. In a word, I would describe palliative care as our dream team. My name is Sherilyn Taylor. I'm from the East Bay, Oakland area, grew up, born and raised here in Oakland. My mom is now a 59-year-old woman with young onset Alzheimer's disease. She was a very strong woman initially, pretty much a go-getter. She was a strong single mother, hard worker. She worked with the elderly. She wanted to give back to that population of people, and she's always been a caregiver herself. Just seeing her decline over the years with not understanding that she had dementia was challenging for me. She was living at home, but the level of care she needed was more than we could provide.
Sherilyn, so we really want to open this up to you all. You guys have now heard Sherilyn's story, and so if any of you have any direct questions, we're happy to hear from you all, and then we'll also allow Sherilyn to share some more commentary on her experience. Does anybody want to start off with a question?
I think I can talk loud enough.
Oh, okay.
My question is, you said that you got the services that you needed to help your mom. What exactly did the palliative care team help you get services for your mom?
At the time, my mom, she had lost. Okay. At the time, my mom had lost a significant amount of weight. So she was like 97 pounds. It's in one of those videos. At some point, you can see that she was really thin and, in the face. She had lost a lot of weight. We didn't know what was going on. She just wasn't holding the nutrition. I forgot what it's called. The diagnosis is like protein malnutrition something. Yeah. And so at that time, it just seemed like it was hospice time. And so they were able to identify that, do all the disability paperwork, placards, and then refer her to a hospice company who then helped us get her into a skilled nursing facility because she was living at home with us for a long time. It was my husband, my 2 small children. I was working full time. I am one of 3 children. I'm the middle child, and I was having to take the burden, which I'm happy that I was able to do that, of taking care of her, but it was really running me down. And so they were able to help our family with that, get my mom the resources and the care that she needed at the time. She spent a year on hospice, graduated out of hospice, and now she is living and thriving, I would say, with her Alzheimer's in a memory care facility in Walnut Creek, California. And it even got to the point where we participate in the San Francisco Walk for Alzheimer's every year. And last year I was able to take her out to do that. And I didn't know, so my mom was in a wheelchair because she's a little weak, but she got up and she walked from Pier 27 all the way to the Fisherman's Wharf. I don't know if you're familiar with that. So she's a great person.
Yes. Can you
was the time when you told yourself, this is it, I need palliative care now?
I formerly worked for Stanford Healthcare, well, a branch of Stanford, and we were doing, you get those emails, you kind of just browse through, there's something happening at lunchtime, you want to spend your lunch hour listening to this. I loosely remembered seeing palliative care, and I was part of a employee resource group, and I was asked to get a presenter so that we can talk about what that meant after I joined that presentation. And so that's how I sort of found out about that. And then it just sort of took off from there. So it was through like a work webinar situation.
So like by accident?
Yeah. I never, before that I hadn't really heard of palliative care. I had seen it. I was, was working in luncheon, and it just sort of, it was like fate,
One of the things that I really find captivating from Sherilyn and is that she's gone on to do this type of work, not just with our team, but she has done a podcast episode on the heart of hospice. So if anybody's interested, just plugging that in. It's an amazing story, and she goes more in depth about her story. But I also wanted to ask you something, Sherilyn. What motivated you to share your story? Because you do a lot of this type of work. Can you talk a little bit about that?
What motivated me was, we talked about social media. I am a social media YouTuber. So I get all my information from YouTube. I'm a graduate of YouTube University is what I call it. And so I didn't see anyone that looked like me. I didn't see anyone, when you look up Alzheimer's or dementia, you get elderly people. You get end-of-life elderly people and all these stories, and there wasn't anyone at all that looked like me. And so with that, I started my own YouTube channel to be that resource for folks like me. There was a lady who was on YouTube. I forget what her name was, but I found her on YouTube, and her mother looked like my mom. Same age. Her name is Jocelyn something. She was also in a documentary that Bradley Cooper just did recently and shared her story. I was able to DM her on Instagram, and she gave me that motivation. She said, hey, just put your story out there. Don't worry about what it looks like, how it comes off. It's authentic if you put it out there the way it is. And that's what motivated me to start that YouTube channel and have that outreach. So I have a few cards if anyone wants the QR code to my channel. It's been a while, but I do periodically post videos of my mom, and then the Alzheimer's Association also helped me get the nerve and the confidence to share my story as well. Yes.
So, I'm in my 70s, and YouTube, and I do try to fix things using YouTube and stuff like that, but I don't know how to use TikTok or Facebook or anything. And we have a website for our community-based program, and I instantly thought, I want to put you on our website. And I was like, but obviously that sounds okay with you, and maybe I do need to take a card from you, not that I know what to do with it. But I think when people are getting referred to our program, a lot of times they're not sure, just like we know. And then we'll get back to them again, and it'll be, well, I looked on, your website, and I think it looks good, or whatever. And I would just think having these videos on our website, and also learning about putting things on YouTube, but we have you to put, to go to. I can send people to you, actually. So I don't feel a need to create anything.
If you know how to copy and paste, that's all you need. If you go on YouTube and you hit the share button, it gives you a link, copy and paste, and yeah, you can send them my way.
And we could put links on our website.
Yes.
Yeah, you can embed the video player really easily.
Yes.
Oh.
Your website guy will know how to do it.
It's so cool.
We would absolutely love that. That's one of my mom's wishes. Before she told me, I think she already knew that she had dementia or some sort of form of that. She was initially diagnosed with schizophrenia, and the medications that she was given, and because she wasn't being heard or listened to by her doctors, the medications really progressed her disease faster than it should have or would have had she been heard. We spend a lot of years going to the top specialists in our areas and telling them that something's wrong, and they're telling her, this is somatic, this is all in your head, this can't be, you're too young. She was in her 40s when all this started happening, and she was pumped with so many medications for mental health, and it spent time in facilities, mental health rehab,
and just was not heard. And it took me to have to come to her doctor's appointments wearing my work badge and dressed up nicely for them to assume that I was her social worker. People in the Black community, as we know or may not know, we're not listened to, we're not heard. We have to fight to be heard. And so that's what it took for me to get our story out there. I had to dress up and pretend that I was somebody that I wasn't, until I got to this team where they were just sitting there on an hour-long Zoom call, and they were like, what else do you need? And I was just I didn't know what else to ask for, and they gave me more than I could ever have asked for. So I'm grateful for this opportunity, grateful for this team, and thankful for all of you all here listening to our story and being willing to help share and get the word out. My mom definitely appreciates this. I told her about it, and I'm going to share this with her when I get back home. So thank you all.
Thank you.
Thank you so much, Sherilyn, for taking the time to come out here and do this panel with us.
When the day came, you couldn't say my name. I didn't let it shake me. When the hallway felt like a maze again, I stayed calm, didn't break, see. Life can turn without warning. Moments slip like rain. And if the memories keep on fading, I'll hold them just the same. Some days I've been, some nights I ache, but love don't walk away. Truth is, loving you is stronger than the pain. Loving the truth is, life with you still washes up the rain. Through every change, I remain, yeah. I remain, I remain. When I whisper your name softly, you smile for a while. I can see the fear behind it, but you cover it with style. I'm right here beside you. You don't walk alone. If yesterday keeps drifting further, I'll be your way back home. Truth is, loving you is stronger than the pain. Truth is, life with you still washes love through rain.